Oh, right. Oh, right there. Yes. Yes.
You're pretending he's working. Does anyone else have final sound check? Are we all good? Good morning, everyone. Thank you for being here today. We're here with Dr. Sarah Cody from the County of Santa Clara's Public Health Department. She will be discussing the bivalent booster eligibility and arrival of the vaccine for 5 to 11-year-olds, as well as our current vaccination numbers throughout the county for the bivalent vaccine. Afterwards, we will take questions in English, and then we will move to the other languages for the press conference in Spanish, Vietnamese, Chinese, and Tagalog. After that, we'll be available for you, and without further ado, we will introduce Dr. Sarah Cody.
Good morning. Thank you as always for being here, and welcome to the fairgrounds, the site of vaccination for now many months. So as you know, with the FDA's recent authorization and endorsement by the CDC, the bivalent booster vaccine is now available for everyone 5 years and up. So if it's been at least 2 months since your last shot and you're 5 or older, you're eligible for a bivalent booster, and we definitely encourage you to get it. Our supply of bivalent boosters for the 5 to 11-year-olds actually just arrived this morning. And as of this evening, anyone would be able to make an appointment online to get one of those shots for the youngest children. As you know, it's the Omicron subvariants that are still circulating now, and it's this new bivalent booster that will protect us from those variants. But I want to tell you, what we've seen so far is a very slow and sluggish uptake of these boosters. In fact, among those who are eligible, just 11% of people living in our county have gotten their booster shot. But now that just about everyone is eligible, I want to just address a question head on. And that question is, do I really need it? Do I really need this bivalent fall booster? And to cut to the conclusion, yes, you do. You need your bivalent booster. And especially if you're 50 years or older, you really need a bivalent booster. And I'm going to talk a little bit about why. So, one, totally reasonable question to be asking, right? Everyone's a little tired of COVID and of this series of vaccines. So, reasonable question, and so glad you asked. So let me tell you. So first of all, you sort of have to think about the risks and the benefits. So let's start with the risks. What are those risks? Well, one risk is it could be quite inconvenient, right? You might get a fever. You might feel lousy. You might need to kind of rest up for a day. And that inconvenience is important. And we have to recognize that it's there. And it is a big deal for some people. Second, I know that some people, young men in particular, may have heard and might be worried about the risk of myocarditis from these vaccines. And it's true that vaccine does increase the risk a bit. But here's the really important thing. Getting COVID actually increased your risk of myocarditis for young men much more than the vaccine. And in fact, the COVID gives you a risk of more severe illness. So the balance tips far in favor of getting vaccinated. And there are many other benefits. So I'm going to 5 benefits of the vaccine that I want to talk about. 1, this vaccine prevents hospitalization and death. And because there is a plane overhead, I'm going to say that again. The really important benefit of this vaccine is that it reduces the risk of hospitalization and death, especially for those who are over 50 years of age. Second, the bivalent booster will reduce your risk of long COVID. So we don't know by how much, but the estimates ranged from anywhere between 15 and 85% reduced risk of long COVID if you stay up to date on your vaccinations. The bivalent booster will give you broader protection. So recent data show that this vaccine will both sort of diversify and broaden the protection that you get, and the protection will last longer than the original vaccines. Number 4, the vaccine will prevent infection and transmission, or at least reduce the chance for a few months. So getting boosted now decreases your chance of getting sick or having to miss an event like a wedding or seeing your friends and family at Thanksgiving or having to miss school or work. And finally, if you do get sick, the booster will shorten the period of time that you're sick. So for example, if you do get sick, instead of having symptoms for 10, 14 days, you're more likely to be sick for just 4, 5, 6 days. So the bottom line is we do recommend this bivalent booster for everyone who's eligible. And if you or a member of your family is not among the 11% who've already gotten the bivalent booster, we encourage you, take your child, take your parents, take a family member, make appointments, and come get boosted. And we really recommend that you do that before the holidays. It's part of holiday preparation. Get boosted, get protected so that you can enjoy the upcoming fall and winter holidays. And I'm happy to answer any questions.
We'll take questions. We'll go around with everyone. Just want a reminder, Dr. Cody will reiterate the question for those people listening online. We'll start left to right this time with Mercury News.
Thank you. How does our vaccination booster rate compare to the rest of the country and even other counties in the Bay Area?
The question is, how does our bivalent booster rate compare to the rest of the country and other counties in the Bay Area? My understanding is that our booster rate, while low and doesn't feel adequate to us, is still higher than in other places in the country. I don't know the data for other counties in the Bay Area, but my guess is that it would be similar to other counties in the Bay Area because it has been in the past.
Are there other issues that you think are discouraging people from getting this booster? Any problems in the chain or mostly ambivalence?
So are there any other issues that I'm aware of that's keeping people from going and getting their boosters? My sense is that the greatest barrier to getting boosted is fatigue. That people are fatigued from managing the pandemic, and that's completely understandable. But what I want to emphasize is that this needs to be a habit that we get into of incorporating these COVID protections into our lives, and getting the bivalent booster will make it much easier to resume our lives, particularly during the holidays.
NBC Bay Area.
Hi. So recently in Santa Clara County, they spotted the BA2.75 subvariant Omicron, and so I'm just wondering, does this bivalent booster offer protection against that? And are we seeing even, last time I checked it was one case, but are we seeing an increase in that particular subvariant?
So we do have detections of some of the newer subvariants, and I am even getting, it is difficult to keep track, particularly because they don't have really catchy names. So I think that we can expect that new subvariants will arise, that if a subvariant has a growth advantage over the whatever's current, that they will grow and prosper. What we understand about this bivalent booster is because it allows your body to create a sort of a more diverse first defense. Think about it that way. So the other vaccines were just to the Wuhan strain. This one protects against BA4, BA5, a newer strain. And so it sort of stimulates your body to make a more diverse set of that first line of defense. And I think that's one of the reasons why it's important to get the bivalent booster to broaden your protection for whatever may come.
Are you working with schools at all now that this booster is available to kids older than 5? Is there any coordination going on there?
So the question is, are we working with schools now that the booster is available for anyone 5 and up? And what does that coordination look like? We have an existing relationship with schools, as you know, and I think that we're more sort of reaching families directly through social media and through media and through school contacts. But I think the important message is think of this as family preparation for the holidays, right? So grab a family member, make your appointments, and come get your bivalent booster. Some members of your family are going to find having COVID an inconvenience, and some members of your family are going to find having COVID very serious and a risk of death. But everyone can benefit from a bivalent booster, and we really encourage everyone to make an appointment and go ahead and get boosted.
NBC?
Sorry, this is Channel 36. Is there any XBB COVID variant in the Bay Area?
I'm sorry, could you ask that question one more time?
Is there any XBB COVID variant in the Bay Area?
Is there any XBB COVID variant in Santa Clara County in the Bay Area? I don't know. The bivalent booster will help to deepen and broaden the immunity in general. And so any new variant that emerges may be more likely to be a bit more like BA5, BA4, and thus the bivalent booster would have a better chance of offering some protection. And that's why we really encourage everyone to get the bivalent booster.
NBC?
Do you have any concern, since only 11% of the adults eligible are getting it, that it will be even more difficult to get the kids to get it if the adults aren't even on board yet?
The question is, if we see that adults aren't all the way on board with getting a bivalent booster, do we anticipate it will be even more difficult to get children boosted? When we look at our booster data for eligible populations, we see that the older you are, the older the age group, the higher percent that have been boosted. And I wish I had brought these data with me, but it's significantly higher for the over 50 and over 65, which is great. And then the percent of eligible who are boosted decreases with age. But I think this is a very important point, is that of course you get boosted to protect yourself from hospitalization or death or missing work or missing school or even just the inconvenience of being sick or to reduce your risk of long COVID. But you also stay up to date and get boosted because you protect others in your family who are more vulnerable. So if you're going to have a holiday gathering, someone in your family is older, someone in your family is immunocompromised, that family member will be much better protected if everyone else in the family has gotten their bivalent booster.
We have one final question from Caroline.
Is the bivalent the only booster available?
The question is the bivalent the only booster available? And the answer is yes. The bivalent booster, so when the FDA authorized the bivalent booster, it deauthorized the other boosters. So the booster, if you're 5 and up and eligible for a booster, you're only eligible for the bivalent booster. It's the only one that's available for you to take.
All right, one more or two more over here, NBC, then KTSF.
We talked to a lot of people who felt like there wasn't a lot of cases now of COVID in the community. So they were talking about timing it. So they'd wait till there were a lot of cases, and then they would get the booster so that they felt that their antibodies would be at the peak time that it's hitting in our community. Can you talk about the timing and why you're saying now is the time? Don't wait until we're seeing a lot of cases in the community.
So the question is about timing of the booster, hearing that some people are trying to time it. We're hearing that cases are lower. How do we think about this? And I have a two-part answer to your question. One is all is not quite as it seems. The reported case rates do look low. However, the wastewater data is telling us a slightly different story. So the reported case rates are low, but the actual level of COVID circulating in the community is not as low. So for that, you have to look at our wastewater data available on our website since October 2020, and you can look at the trends. And if you look at that, you can see, oh, well, it looks like it's slowly drifting down in kind of a stuttering fashion, which is fantastic, but it's still pretty high. It still looks like it did in February of this year and April of this year. And so the key take home here is that your risk of exposure, you still have a pretty reasonable risk of exposure. And that's why you have to think back to those layers of protection that we've all been practicing for so long, and employ them. It's extraordinarily difficult to predict the future and time the booster. I think we can anticipate that we will see an uptick in the fall and winter. That's what we've seen the last 2 years. And we're in the fall. So I think that, getting boosted in the next 2 weeks makes terrifically good sense. It ensures that you will be protected if you are planning to gather at Thanksgiving or in December. You'll be in good shape if you make an appointment and get boosted in the next couple weeks.
Do one final question from KTSF.
They asked a question about the flu. How bad are the flu season in Santa Clara County, and how many cases and hospitalization about the children?
So the question is about the flu season. How's the flu season looking now in Santa Clara County? We are anticipating a worse than usual flu season, mostly because of what we've seen in the Southern Hemisphere, and that we usually can use the Southern Hemisphere as a guide. Influenza is not, all cases of influenza are not reportable to us, so we have other ways of tracking it. We can look at severe illnesses, deaths in people who are young, reports of outbreaks, as well as what our laboratories are seeing. So we are starting to detect flu in the community. It's not yet taken off. I do want to let everyone know that we do have a flu dashboard. Just like we have a COVID dashboard, you can go on our website and look at the flu dashboard and stay abreast of what's happening in Santa Clara County.
Thank you, Dr. Cody. I think that concludes the questions in English. What we'll do is now move on to the Spanish portion of our press conference. Thank you.
Great.
Buenos días. Este día, el Departamento de Salud Pública del Condado de Santa Clara quiere compartir un mensaje muy importante acerca de la vacuna de refuerzo bivalente contra el COVID-19. Y el mensaje es que ahora los niños de 5 a 11 años son elegibles para recibir la dosis de refuerzo, siempre y cuando hayan pasado 2 meses después de haber completado la serie inicial. Las vacunas han llegado al condado y actualmente ustedes pueden hacer su cita a partir de esta noche. Se espera que esta vacuna de refuerzo proteja contra la actual variante dominante Omicron y también que sea beneficiosa contra otras variantes adicionales. Nos gustaría enfatizar que hasta el momento solamente 11% de la población del condado de Santa Clara ha recibido la vacuna bivalente de refuerzo contra el COVID-19 y sería de beneficio de la comunidad para que todos la adquiramos. Actualmente estamos observando que en las aguas de desecho existen un número mayor comparado con el número de las pruebas de COVID-19, lo que indica que probablemente los números de casos de COVID-19 son mayores de lo que se han registrado. Además, la administración del presidente Biden extendió la emergencia del COVID-19 para prepararnos para un posible aumento de casos en la temporada de invierno. Esto es porque en los últimos 2 inviernos se ha visto un aumento en los casos y por lo tanto se espera que este año va a ocurrir la misma situación. Esto significa que es ahora cuando es el mejor momento para hacer una cita y para recibir su vacuna de refuerzo bivalente contra el COVID-19. Estas son solamente algunas de las razones por las que le estamos animando ahora a los niños desde los 5 años o a todas las personas desde los 5 años en adelante y especialmente a todas las personas mayores de 50 años a que hagan una cita y que tengan su vacuna de refuerzo del COVID-19. Si usted experimenta alguna situación de dificultad con hacer una cita, usted puede también ir a nuestra página electrónica que es la www.sccfree.org y ahí va a encontrar información de cómo hacer una cita y también de cómo comunicarse con nosotros. Otra vez, las vacunas están en el condado ahora y usted puede empezar a hacer su cita a partir de esta noche. La dosis de refuerzo bivalente es la forma más importante, la forma más efectiva para prevenir la enfermedad del COVID-19. También para prevenir la severidad de esta enfermedad, las hospitalizaciones y la muerte. También ustedes pueden prevenir una falta de ir a la escuela, una falta de ir al trabajo y, por supuesto, el contagio a otras personas que son vulnerables. Es bien importante que todos nos protejamos. Esta vacuna de refuerzo está dándonos una oportunidad de protección adicional para que los casos del COVID-19 disminuyan. Por lo tanto, otra vez, nuevamente, les animamos, les exhortamos a que todos hagan su cita y que también tengan su vacuna de refuerzo del COVID-19. Muchas gracias. My name is Patricia Cerrato. My title is Program Manager of the Immunization Program with the Public Health Department, Yeah. My name, Patricia, P-A-T-R-I-C-I-A, and Cerrato, C-E-R-R-A-T-O. You're welcome.
Kính thưa quý vị, hôm nay chúng tôi mang đến cho quý vị một tin vui, đó là liều hỗ trợ mới nhất có thể chống biến thể Omicron vừa được cơ quan CDC phê duyệt cho trẻ em từ 5 đến 11 tuổi. Và điều này có nghĩa là các bậc cha mẹ sẽ có một vũ khí rất tốt để bảo vệ cho con em vào mùa thu và mùa đông này. Và quý vị có thể lấy hẹn trên trang sccfreevax.org bắt đầu từ tối nay để lấy hẹn cho các bé. Trẻ em cần đợi ít nhất là 2 tháng từ khi tiêm liều hỗ trợ hoặc liều tiêm ngừa cuối cùng, và các bé cũng cần được tiêm loạt thuốc đầu tiên trước khi tiêm liều hỗ trợ Omicron. Liều hỗ trợ Omicron này không thể thay thế được các liều tiêm ngừa đầu tiên. Ngoài ra thì những người từ 5 tuổi trở lên sẽ được tiêm liều hỗ trợ này, và chúng tôi cũng đặc biệt khuyến khích quý vị nên đi tiêm ngừa và cho con em đi tiêm ngừa. Nếu con của quý vị gần đây đã bị nhiễm COVID thì quý vị có thể đợi từ 2 đến 3 tháng trước khi tiêm liều hỗ trợ. Tuy nhiên, các bác sĩ khuyên không nên đợi chờ lâu hơn là 3 tháng. Nếu con trẻ của quý vị đã bị nhiễm COVID trong năm vừa rồi thì nhất định là quý vị phải cho con tiêm thêm liều hỗ trợ Omicron, tại vì sự miễn nhiễm mà các bé có được đã bị giảm đi rất nhiều với thời gian. Chúng ta rất may mắn đã có được các thuốc tiêm ngừa này, nhưng phải nhớ là chúng cũng có một số giới hạn, và một trong những giới hạn đó là sự hiệu nghiệm sẽ giảm bớt theo thời gian. Đó là lý do tại sao mà các liều hỗ trợ quan trọng đến như vậy. Và trong trường hợp con của quý vị bị nhiễm COVID-19 thì liều hỗ trợ thật sự giúp cho trẻ chỉ bị nhiễm nhẹ và cũng làm giảm việc bị nhập viện hoặc là tử vong. Chúng ta cũng có được bằng chứng là tiêm ngừa cũng làm giảm bớt cơ hội bị COVID kéo dài, có thể ảnh hưởng rất tai hại đến phổi, tim và đầu óc của trẻ em. Vì vậy, xin quý vị hãy cho các trẻ đi tiêm ngừa ngay. Tất cả các hệ thống y tế trong vùng cũng có thể đã có liều hỗ trợ rồi, hoặc là cũng sẽ có được trong tuần này. Tại địa phương chúng ta đã bắt đầu thấy mức lây nhiễm còn thấp của biến thể được gọi là 2.75 trong nước thải. Và chúng tôi đang theo dõi những cái biến thể này. Cơ quan CDC cũng báo cáo là cứ mỗi trường hợp nhiễm trên toàn quốc thì có một trường hợp nhiễm do 2 biến thể mới được gọi là BQ1 và BQ1.1. Tất cả đều là những biến thể của Omicron. Điều này có nghĩa là liều hỗ trợ mới cũng sẽ bảo vệ phần nào chống lại các biến thể này. Xin cảm ơn quý vị. Chúng tôi là Như Hạnh, nhân viên truyền thông của quận Hạt.
大家好，我是圣塔克拉拉县县政府的 Benny Chen 张志斌。圣塔克拉拉县在联邦疾病预防控制中心，也就是 CDC 核准之后，将从今天晚上开始接受5到11岁的儿童预约，在县政府所设立的大型疫苗的接种地点以及本地的诊所开始接种2价新冠疫苗的加强剂。CDC 表示，儿童最快在完成新冠疫苗初始系列，也就是头2针的疫苗接种，或者是最近一次接种新冠疫苗加强剂的2个月之后，就可以接种这一款针对 Omicron 变种病毒的更新版的2价加强剂。2价疫苗因为同时针对新冠病毒的原始病毒株，以及目前占主导地位的 Omicron BA.5 的变种病毒株，所以应该能够对于新冠病毒的传播提供更高水平的防护。然而很重要的是，要记得疫苗的效力会随时间而递减，因此要持续按时接种新冠疫苗，包括这个新的2价加强剂在内。目前在圣塔克拉拉县符合接种条件的人当中，只有接近11%接种了这个更新版的加强剂。因此，公共卫生局鼓励所有符合接种2价新冠加强剂，也就是俗称 Omicron 加强剂的民众，无论是儿童还是成人，都去接种更新版的2价新冠加强剂。诚如公共卫生局局长 Dr. Cody 刚刚指出的，我们在过去的2年当中都经历了冬季的疫情传播的高峰，因此我们每一个人都应该要继续尽可能的采用多重的防护措施，尤其是使用最新的新冠疫苗。 而这种针对 Omicron 变异株的新冠疫苗，可以大大的降低造成重症的机会。假期即将来临，相信有很多亲朋好友相聚的时间。这个新冠疫苗的加强剂可以有效的降低传染风险，而且一旦染疫的话，也很有可能帮助染疫的人能够减低这个感染的症状，并且也可以缩短这个受到疫情感染所苦的这个时间。因此，非常鼓励大家，不管是大人或者儿童，都尽快的安排接种。现在要预约打疫苗其实很容易，因此也提醒您，可以洽询您自己在本地的主要的医疗照护提供者，也就是您的家庭医生，或者是本地的一些诊所或是药局，听您自己或者是孩子来预约施打这个加强剂。如果您没有家庭医生，或者是预约接种发生困难的话，您可以上网 www.sccfreevax.org www.sccfreevax.org 来预约接种。最后也要提醒您，在加州，只要您工作的单位员工总数不少于26名，就可以因为自己或者一位家庭的成员需要去接种疫苗，而请有薪的病假。这项加州州政府的计划将会持续到2022年结束为止。在这里，也请符合资格的民众能够善加利用。Next, my colleague Sherry Ann will provide the statement in Tagalog.
Magandang umaga po sa inyong lahat. Ako po si Sherry Ann Mangligot, ang inyong Public Information Officer dito sa County ng Santa Clara. Ang County ng Santa Clara ay tumatanggap na ngayon ng appointment sa Bivalent COVID-19 booster para sa mga batang nasa edad na 5 hanggang 11. Ang County ng Santa Clara alinsunod sa kasalukuyang pag-aproba mula sa Centers for Disease Control and Prevention ay mag-uumpisa ng tumanggap ng mga appointment mamayang gabi para sa COVID-19 booster para sa mga batang nasa edad na 5 hanggang 11 sa kanilang malawakang lokasyon ng pagbabakuna at mga lokal na klinika. Ang mga bakuna ay dumating na at mag-uumpisa ng tumanggap na appointment para sa mga COVID-19 booster. Ayon sa CDC, ang mga bata ay makakakuha na ng bagong Omicron-specific booster sa lalong madaling panahon na 2 buwan pagkatapos ng pagkumpleto sa inisyal na serya ng COVID-19 o ng kanilang pinakahuling COVID-19 booster. Ang mga bivalent na bakuna ay nagbibigay ng mas malaking antas ng depensa laban sa COVID-19 sa pamamagitan ng pagtutok sa orihinal na katangian ng novel coronavirus, lalo na ang kasalukuyang dominant Omicron variant. Ang bawat antas ng depensa ay maaaring patunay na mahalaga dahil ang mga ibang Omicron variants ay mabilis na kumakalat sa ibang bahagi ng United States. Importanteng tandaan na ang pagiging epektibo ng bakuna ay humihina sa paglipas ng panahon at pagiging up-to-date sa bakuna kabilang ang bagong bivalent booster. Pinapaalalahanan ang publiko na tignan ang kanilang lokal na healthcare provider o parmasya para sa isang appointment. Sa mga walang primary healthcare provider, o sino mang may kahirapan sa paghahanap ng appointment ay maaaring bumisita sa www.sccfreevax.org. Maraming salamat po.